When I switch it on, it'll go beep, as they all do.
Electrotherapy has been used in physiotherapy practice for many years.
So that's all you'll feel.
Modern physiotherapy practice needs to be evidence-based, and electrotherapy is no exception. Research into electrotherapy is ongoing, and the evidence about physiology and effects presented in this film are subject to change as the research progresses. It is important to bear in mind that of the evidence that exists currently, the quality is variable, sometimes good, sometimes not so good, and the results are at times contradictory. In tandem with research evidence, electrotherapy use requires skilled clinical decision-making as to which modality to use and when. Used in the wrong situation or using the wrong dose can be ineffective, or at worst make a patient's condition deteriorate and may even be dangerous. All electrotherapy modalities involve the introduction of some physical energy into the body. This causes physiological changes that will then have a therapeutic effect to enhance the body's natural ability to stimulate and control the healing and repair processes. Interferential uses the physiological effects of low-frequency electrical stimulation of muscle without the unpleasant sensation of such treatment. The low frequency is generated by applying two medium-frequency currents to the patient, set up so their paths cross and interfere with each other. This produces the effects of a low-frequency type current. The range of frequencies produced and the tissues stimulated by each are: sympathetic nerve 1 to 5 Hz, parasympathetic nerve 10 to 150 Hz, motor nerve 10 to 50 Hz, sensory nerve 90 to 100 Hz, nociceptive fibers 90 to 150 Hz, and smooth muscle 0 to 10 Hz. On this basis, the clinical effects of interferential are claimed to be pain relief, muscle stimulation, increased blood flow in the area, and reduced edema in the area. Interferential to lower back pain using vacuum electrodes.
Morning, Julie.
Hello.
What we're going to do today is we're going to give you some interferential to your back for your back pain. Is it okay if I just pull your t-shirt up so I can get to your back?
Yeah.
Okay. That's great, thanks very much. If you just lie back down, are you comfortable there?
Yeah.
Okay. Now the interferential, what you will feel is like a tingling sensation around this area of your back where you have your pain. So are you happy for me to do that?
Yes.
I mean, while you have it on, should it make any of your symptoms any worse, or you feel uncomfortable, or in any other situation, you need to let me know and I will come and take it off. Okay? First of all, what you need to do is to test your skin to make sure you can tell the difference between sharp and blunt. So what I'm going to do is I'm going to pop that on your skin of your back. That's sharp and that's blunt, and I want you to tell me what you can feel, sharp or blunt. Okay?
Sharp, sharp, blunt, blunt, sharp, blunt.
That's fine. Okay? Put this away. So we're going to put some suction cups on your back. It might feel a little bit cold because the sponges are wet.
The same coloured leads and suction cups need to be applied diagonally opposite to each other, so that the two medium frequencies interfere with one another and generate the desired low frequency effect appropriate for the condition being treated.
Does that feel alright? That's just going to feel that that's the suction of the machine, that's not the actual treatment. Right, now I'm going to turn the machine up nice and slowly, and what you will feel is a tingling sensation, and I want you to tell me when it starts to come through. It's got to be pleasant and not uncomfortable.
Working on the principle that different frequencies have effects on different tissues, a program is chosen that uses 90 to 150 Hz for 20 minutes. as this targets nociceptive fibres and therefore provides primarily a pain-relieving
I'll
effect.
just turn it up a little bit more. Is that still prickly?
Accommodation to the sensation may occur,
Tingly.
and the intensity may need to be increased during the treatment session to counteract this effect.
Okay, so I'm going to leave you there with that on. If you have any problems, I need you to give me a shout and let me know. Okay? Okay, Julie, that's finished now. I'm going to just turn the suction off on your back. Take the suckers off. A suction can leave a little few red marks, but they will soon fade by the time you get home this evening. Okay? So if you just pull your top down. There we go. If you'd like to get yourself up and get dressed. Okay?
Interferential to an acute synovitis of the knee.
Morning, Julie. Going to give your knee some treatment today and give it some interferential, seeing as you had that injury playing hockey at the weekend. And I know it's still feeling quite a bit sore. So what I'm going to do is give you some interferential, and the interferential, what it will do is it will try and improve the circulation to the area and try and get rid of some of the swelling that you've got and make it feel a lot better. Okay? Are you happy for me to do that?
Yeah.
What I need to do first is to test your skin to make sure you can tell the difference between sharp and blunt. So I'm going to just pop that round your knee. That's the sharp and that's the blunt.
Okay.
So if you could look away, close your eyes and tell me whether you can feel sharp or blunt.
Blunt. Blunt. Sharp. 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 Blunt.
That's fine. Thank you. Now interferential is going to feel like a tingling sensation, and I'm going to put one of these pads either side of your knee so you'll feel the tingling all the way around.
Okay.
It shouldn't feel uncomfortable, it should feel, you know, like a pleasant sort of tingly, pins and needly type feeling. If it does get uncomfortable, then you'll need to tell me and we'll take it off. Now then, can you just lift your knee a little bit for me? Thank you.
Application can be by a two-pole technique. Here the interference occurs in the machine to generate the desired low-frequency effect.
Just strap this on. Okay, just let your leg go nicely relaxed down. Okay, so that doesn't feel too tight?
No, that's fine.
Primary effects are through motor nerves affected by interferential between 10 and 50 Hz for 10 minutes. And this then causes muscle stimulation with the resulting increase in blood flow and possible reduction of edema.
Okay, I'm going to put it on for 10 minutes and I'm going to start turning the machine up now. So you tell me when you start to feel it. As I say, it'll feel like a tingling sensation. It's got to be comfortable and not unpleasant.
Right, I can feel that now.
Tingly?
Yeah.
Okay. Comfortable?
Yeah.
Right. I'm going to leave you to it, but if you have any problems, please give me a shout.
Okay.
That's it finished. Let's take these off. How do you feel, alright?
Okay.
Okay.
The following situations or conditions are contraindications to interferential. Patients who are unable to understand or cooperate. Patients whose skin is damaged or bruised. The pelvis during pregnancy. Eyes. Anterior aspects of the neck. Carotid sinuses. Patients with pacemakers, where there is danger of hemorrhage or current tissue bleeding. And epiphyseal areas in children. Patients on anticoagulation therapy with a history of pulmonary embolism or deep vein thrombosis should not be treated using vacuum electrode applications.